there's your fibular head. Okay? And the posterior glide is basically, I get her knee into some flexion with her foot in about 10 degrees of plantar flexion. Okay, so she's just slightly plantar flexed. Once I find the fibular head, I'm going to take my thenar eminence and put right over it because it's nice and soft and cushy, versus my thumb, which is going to feel very uncomfortable to her. Okay? So I take my thenar eminence, and I'm just going to hold the tibia with my stabilizing hand and then apply a direct posterior glide with my mobilizing hand. So my mobilizing hand's right over the fibular head. I keep my elbows straight, and all I'm going to do is lean down. Feel that? Okay? So that's my assessment. That's all I want you guys to do right now, is just to assess and compare to the other side. So I got to figure out how to use both hands and decide if there's hyper or hypomobility. You can you switch back to this one? You can sneak a finger back. Helps. You can slide a finger behind the fibular head to feel it move into your finger. If that helps you get a little sense of how much motion there is. For the anterior glide, there's a couple different ways to do it. Your book shows you a couple things. You can come behind the fibular head here, but you got to get into that soft tissue, which can be uncomfortable. And I'm going to use kind of the pads of these fingers, and I'm going to take my time before I do any pressure to sink down to the bone and get my hand ready. See if her face already? I'm not liking it. And all I'm doing is pulling this direction. So I get my hands in there and I pull forward. She can't stand it. Someone have her lay prone. Can you scoot towards me? Get her in this position, and now I can use my thenar eminence. Put her in a little bit of plantar flexion, and now I do an anterior glide. Much more comfortable?
Yep.
Okay? All right, so why don't you guys assess